Great. Well, welcome everybody, and welcome to the second in a series of webinars presented by Progressive Mass that examines the attack from DC and what we can do in Massachusetts. My name is Enid Eckstein. I'm part of Jamaica Plain Progressives and part of Progressive Mass, and worked on this discussion series along with Jonathan, who you just heard from, John Kiriakis, and Carolyn Bays. Tonight, we have co-sponsors Mass Care and ORMA. We'll hear brief words from them at the end of the evening. But I just want to say that there are many organizations working for change in our delivery system. But tonight, our focus is explicitly on the attack on Medicaid and Medicare and its impact on Massachusetts services and workers and the economy of our state. And while many of us are in different fights around healthcare reform to a broken system, tonight, what we'll be talking about is the need to prevent immediate and imminent harm to the system. Tonight's discussion, as you will hear, is extremely timely given the budget reconciliation process underway. Budget reconciliation, for those of you who don't know, is the legislative tool that can be used by the majority party in Congress to advance their goals. And that's exactly what they're attempting to do. Trump wants to pay for his defense spending, border security, and fund tax cuts for the rich. And that's what they're going to be using the reconciliation process to do. And they can only do this in certain ways, and they can only go over programs that are mandatory spending. And one of the ones that they're looking at is Medicaid, Medicare, SNAP, et cetera. And you're going to hear examples about that tonight. So initially, the legislature was looking at reducing Medicaid spending by $800 million. House Republicans, as you will hear, have begun to push back, as well as lots of Democrats have been pushing back, and people have been hearing this at town hall meetings, et cetera. So we begin to see some retrenchment and some walking back on some of the cuts. But nonetheless, there are cuts to Medicaid that will tend to make it harder for people to get health insurance and could impact 71 million enrollees. And I'm just going to say a few of these, and then I'm going to introduce our special guest. Among some of the changes being debated are cost sharing, where they'll ask Medicaid recipients to pay more of their coverage, which once again falls on those people least able to pay. They're looking at work requirements for people on Medicaid, even though many people are working over 60%. And they want to limit provider taxes used by states to draw extra federal funds. That's just a few of the choices that the government will be making, that elected officials will be making. But that's exactly the direction they're going in, which is to make it harder for people to stay on the plan and to make health insurance less affordable for those who can least afford to have increases. But that is really tonight's topic. We have several speakers who will speak to the crisis. We have Don Berwick, who we'll introduce in a minute. We also have Jamie Willmuth from 1199. We have Alex Sheff from Healthcare for All and Crisayda Belén from Field First. But tonight, before we start our program, we actually have a special guest. We have somebody who is representing Massachusetts in the House of Representatives and is right on the floor of Congress right now dealing with budget reconciliation. And since she just called in, I want to make sure we introduce our honorable Congresswoman, Ayanna Pressley. And I'm now proud to say I'm a constituent of yours because I just moved. So really glad to have you, Ayanna Pressley, and take it away.
Well, lucky me. Thank you, Enid, and Jonathan, and everyone who made tonight possible. I have to say, for a moment, I didn't know who you were talking about because I'm hardly a special guest. We're movement family. And I was sort of sitting there saying, "Oh, I'm so glad I'm not going first because I want to hear what Don has to say." So, but I'm grateful for the opportunity to join you all for a few words. I'm going to do my best to stick to my notes, but I have lots of thoughts and lots of feelings being here in the belly of the beast every day. First and foremost, I just want to say thank you all for being here and continuing to do the work of organizing and mobilizing in Massachusetts. As you've heard many times before, I keep revisiting Dr. King's urgent question, where do we go from here, chaos or community? And we have to continue to choose community and to be very intentional about this. Um, you know, the I did an interview earlier today, and it might shock you to know that I still get asked if there's any opportunity to do work that is bipartisanship, to which my response is, well, where is there a party to do bipartisan work with? My colleagues, my Republican colleagues in the House are operating like a cult of cowards, complicit in wholesale harm, who have ceded all of their congressional responsibility and authority, even. And it is it's challenging and infuriating to bear witness to that they are complicit in this wholesale harm. And in the midst of this budget reconciliation fight, in our committee hearings, where normally we would be in vigorous debate, each side defending what they're fighting for, or why they believe something should be cut. They are just quiet. So, what you're doing is essential, that you are making sure that people are informed, because in a dictatorship, uh, um, what a dictator wants is a citizenry that is ignorant and uninformed. They want a citizenry that is indifferent to the suffering of their neighbors, and they want a citizenry that is inactive. And so you all are antithetical to all of that, and for that I'm grateful. So again, I wanted to just drop in virtually for a moment and speak with you all as this callous Republican reconciliation bill advances through Congress, both so people clearly understand the impact and how we can all stand in the gap. Again, MAGA is a cult, but that cult is a movement. So the only way to beat a movement is with a movement, which is why we need all of you. And the only way to beat a dictator is with defiance, which we have to do at every turn, reject and resist this vision, this Donald Trump's America. Now, I'm going to let former CMS Administrator Dr. Berwick share the specific implications for Medicaid, but I want people to understand exactly what we're dealing with here in Congress, because when we say Republicans operate with cruelty, and that is the point, we mean it. They keep saying that where in the reconciliation bill does it say cut Medicaid? It's true, it doesn't say that. However, when the lion's share of these cuts are going to come out of the Energy and Commerce Committee, and you charge the Energy and Commerce Committee to cut $880 billion, the Congressional Budget Office, which is an independent entity, says it is impossible. You cannot cut $880 billion and not drastically undermine and degrade essential safety nets. For example, the Agriculture Committee, they've given them the order to eliminate $230 billion in savings. Well, there's no way you can do that on the Agriculture Committee and not cut SNAP. So, all of this is being done in the name of so-called efficiency. I have no idea why they're under the very devastating opinion that making people sicker, hungrier, poorer, what kind of efficiency, is that? So, and you all know this. This is a massive tax giveaway to Trump's billionaire donors like Elon Musk. And you also know that Medicaid is sorely needed. It is a lifeline. It is also a wildly popular program in both Republican and Democratic districts. Which is why, I don't know if any of you had on your bingo card that there would be a Stop the Oligarchy tour with Senator Sanders and Representative Ocasio-Cortez in Idaho, with tens of thousands of people showing up. But that is exactly what is happening, because programs like Medicaid are wildly popular, sorely needed in Democrat and Republican districts. And one of the things I do believe we are starting to do effectively is to make the Republicans wear this stuff. In fact, we have a discharge petition, which is a legislative tool that we use on the floor to force a vote. And that discharge petition that is on the floor right now is called Hands Off Medicaid and SNAP. And after we hit that magic number, it will force a vote. And the Republicans, they can run, but they can't hide. They're running away from town halls in community. They are being complicit in their silence in these committee hearings during budget reconciliation. And so we're going to force a vote. They say that they can't support anything that cuts Medicaid because they recognize how sorely needed and popular it is in their districts. So we'll see. We'll force a vote. And We shall see. We shall see. Push come to shove. What is the vote that they ultimately cast? Um, the other thing that I wanted to raise in that Republicans are being complicit and that they are running constantly, it's gotten to the point that I now have constituents from Republican districts that are reaching out to me to elevate and to amplify their story. I don't know if any of you saw in the Financial Services Committee budget reconciliation debate last week, much to the chagrin of Representative McClain of Michigan, who's in GOP leadership, I elevated the story of Mary, a 70-year-old hospice nurse who is raising an autistic son who's nonverbal, who cannot be left alone because it would be injurious or dangerous to do so. He relies on Medicaid and Social Security. She has another son who helps to care for him, and she received a phone call to come to the office to talk about his benefits. And she's holding her breath, fearful of what's on the horizon for them. Her son's name is Sean. Her name is Mary. Again, she's a 70-year-old hospice nurse. And she said, if we lose Medicaid, it will be a death sentence for my son. So I told that story in this committee hearing and made an appeal to my colleagues across the aisle. Anyone? Reaction? Rep. McClain? Anyone? And they were just scrolling their timelines, just no reaction whatsoever. So these drastic cuts are void of both common sense and compassion. And again, they have nothing to do with efficiency. So I'm sounding alarm to every person who calls this country home that this budget will bring further hurt and harm, and that Republicans would rather fall in line behind dictator Donald Trump than stand up for their constituents. They're afraid of retribution and they're more focused on keeping a job than doing it. So I've been leveraging my positions on the Oversight and Financial Services Committee. I believe the Democrats' best defensive strategic response is, of course, litigation. Legislation like that which I just named, because when I name legislation, people say, well, you're in the minority, what bills can you move? But the fact of the matter is they have a technical majority. It's just two Republicans. So we're just appealing to any person of conscience, and there are bills that we can move that would protect your data from Elon Musk, that would ensure that Congress maintains its authority when it comes to tariffs, that would ensure that there are not cuts to Medicaid and SNAP. So our defensive strategies are litigation, which are winning a number of federal cases, legislation like the discharge petition that I just spoke of, agitation, which I certainly am doing every place that I can, including rural Louisiana to detention facilities, and mobilization, like what you're doing here today. Because as I said, MAGA is a cult, but it's also a movement, and the only way to beat a movement is with a movement. So I know you all know how bad everything is. I know I'm preaching to the choir, but even the choir needs rehearsal. And we all need to be, singing from the same song sheet here. So one of the ways in which you can continue to be helpful is to just combat the misinformation. Executive orders are not law. Most of what's being introduced and proposed by Donald Trump is unlawful, which is why litigation remains, our most effective defensive strategy. But we know whether an executive action happens or not, it still has a chilling effect, and it's impacting how people live their lives and decisions that they make. There's so much information out there, misinformation out there. So it's really incumbent on all of us to make sure the people in our lives, even the neighbors that we don't agree with, understand that the fight over Medicaid impacts all of us. If you're not personally enrolled in Medicaid, chances are you have a family member or a loved one who is. Medicaid provides health care to almost half of all children in the United States. There are some 80 million Medicaid recipients. I believe 1 in 5 Medicaid enrollees are Black. So I have grave concerns about the ways in which this will exacerbate health disparities, especially in that Black women are still 3 to 4 times more likely to die in childbirth or post-birthing complications. And there are so many women for whom this is the only way that they're able to have prenatal care, the only way to have health care. People that are in low-wage jobs that would now be uninsured and unable to access health care to treat their asthma or chronic diseases, high blood pressure, heart disease. It covers the cost of life-saving medications, as I said, ranging from high blood pressure to dementia to asthma and beyond. So ripping away this lifeline for millions of families is simply to give more tax breaks to billionaires is going to hurt all of us. I think there are people who voted for Trump and who thought that pain would come, but it would not come to them. But as James Baldwin reminds us in his letter to Angela Y. Davis, if they come for you in the morning, they'll surely come for me at night. And this pain is going to be felt by everyone. And again, here's the thing as I close, it only takes 4 Republicans to join us to protect basic programs like this. So, look up who are these Republicans that won their seats with less than 3%. We've got to apply pressure. So the first thing you can do is think of anyone, literally anyone in your phone book who's represented by a Republican, ask them to call their representatives. They need to hear from their constituents and wear the pain that they are causing. The second thing you can do is practice mutual aid with the people in your own community as much as you're able to. There are several mutual aid networks in the greater Boston area that were started during the pandemic. I keep using the pandemic as a reference point because it was wholesale harm. So we learned a lot from it about how to rapidly stand up infrastructure to help our neighbors, and we can do that again. The final thing I'll add is that we have a long road ahead of us. The path to justice is not paved with postcards to voters in the midterms, though, of course, we must do everything we can to take back the gavel. But we have to, in this moment, practice stamina, strategy, and resolve and continue to choose community because, again, this hurt and harm is coming for everyone. And this moment requires us to think about how we show up for one another, how we build stronger communities and bonds at the local level. In times of crisis, we need neighbors who will show up for us in a moment of need and know that we'll be that person for someone else. So we have to continue to reject, resist, denounce, disrupt, and put our bodies on the line. And I'm so grateful to all of you for being my siblings in this work. I will let you transition the program, and I'm going to listen for a little bit before my next thing. Okay, but I will go off camera. Thank you.
Thank you, Congresswoman Pressley. We're really, grateful for you joining us tonight. And as you said, we need to sing as the choir. We need to raise our voices, and that's what tonight's forum is about. So let's get started here in terms of the content. So our first speaker is Don Berwick. Don Berwick is President Emeritus and Senior Fellow at the Institute for Healthcare Improvement, which was about improving healthcare quality. But most importantly for tonight's discussion, he was the former administrator of the Centers for Medicare and Medicaid Services. He has many titles, but the one that I got the most kick out of when I was reading his bio is he's an honorary knight. And he's an honorary knight who's joining us tonight because he had done some service for the British National Health Service. So he brings that experience as well. But tonight we're hoping he'll share some of his insights with us about what is actually happening in terms of the future of Medicaid and his view from having been the administrator of the program. Thank you, Don.
Thank you, Enid. You left off one credential. My wife and I moved to Boston 4 months ago.
JP, I know where
Constituent of Ayanna Pressley, and I could not be prouder, Congresswoman, to have you representing me, and you can always count on my help. You're a real gift to this country. I'll try to be brief. First, I want to make a point that should affect progressive mass, which is that our healthcare system overall does not function very well. It's extremely expensive. It leaves 20 million people out of care still. It has enormous hazards in care. It isn't reliable. It is inequitable and has inequitable results. From the richest part of Boston to the poorest part of Boston, life expectancy differs by about 20 years, believe it or not. So if there were no Trump, if there were no Republicans, if we were living in a Democratic administration, we would still want to put at the top of the list improving American healthcare to make it just, equitable, safe, and the envy of the world. Instead, we rank 40th in infant mortality, 40th in health status in the world. That's not good. Now along comes Trump with a breathtaking attack across the front on health and healthcare in America to make it even worse. Congresswoman Pressley has put up the immediate poster child right now is Medicaid because of this horrific intent to return trillions of dollars to wealthy people in this country and to overinvest in military and other categories. He has to find $860 billion over 10 years to pay for it. It can't be done. But if you're going to try, the only pot of money big enough to possibly pay for these nonsensical and unjust expansions in expenditure is Medicaid. As Congresswoman Pressley pointed out, I won't dwell on it, but there are all sorts of maneuvers that are underway, not just the reconciliation budget to cut Medicaid expenditures, but also to encourage expansion states to withdraw expansion, to move to block granting, which is a way to fund Medicaid that will leave states high and dry, and to allow states to put up enrollment barriers that are astoundingly difficult. People who already are facing enormous threats in their life now having to come in with piles and piles of paperwork just to stay on Medicaid, which they deserve anyway. The other thing that I want to just emphasize that Congresswoman Pressley mentioned is Medicaid is not just a problem for poor people. It's a problem for the middle class. It is America's safety net. 50% of nursing home beds are paid for by Medicaid. It provides a tremendous amount of the mental health care we need in this country. So the effect of this cutback in Medicaid is devastating. Millions of people will lose coverage in programs and their health will suffer. Meanwhile, on the Medicare front, it's a little more subtle and not so much headline right now, but this administration has shown its colors. Just to be clear, in Medicare, there is $100 billion a year of subsidy going to Medicare Advantage, private Medicare plans, which have been found by the MedPAC, Medicare Payment Advisory Commission, to be pure waste, no value add. If the Republicans want $860 billion to pay through tax cuts for rich people, why not go after Medicare Advantage, which is simply lining the pockets of insurance companies? That's, by the way, why I endorse Progressive Mass's investment in trying to find a way to have national health insurance for everybody. But the Republicans have shown no or very little appetite for recovering that waste. Their aim with Medicare, I want to be really clear, is privatization. Dr. Oz has been clear about it, and there is an agenda underway to make Medicare, which is still about 50% public insurance, the rest goes through Medicare Advantage to private plans, um, uh, truly public, accountable. When I was Medicare administrator, my board was the Congress, and my duties were to Americans. And I had no opportunity to line my pockets or do what the health plans are doing on the private side. But their intent is to privatize Medicare, and we are losing that battle. It's quite unstable. And enormously important organizations like Progressive Mass and your other sponsor colleagues tonight need to understand that we have to fight back hard against this movement toward privatization. I do, by the way, believe there could be some Republican interest in stopping that because they know it's waste, and there are some in Congress on the Republican side who are showing some colors to push back on this incredibly costly subsidy. Um, and another way that Medicare Advantage does its work is to withdraw coverage from people by requiring pre-authorization and then denying care or cutting their benefit structures. There are a couple of other fronts I want to mention in a minute or two I have left. First is the attack on science. This is about health. Modern healthcare depends on science, and to cut the NIH budget 50%, to abolish the Agency for Healthcare Research and Quality, to cut CDC to the bone, including its research and database characteristics, is the opposite of making America healthy again. It's making America even sicker than it is, and they're absolutely no apology for this cutback in the very foundations of the knowledge base upon which we depend to make healthcare what it should be. When I was a physician in active practice, I looked to science to tell me how to help people. That science is being attacked. And on the public health front, it's in some ways even worse. Look at the budget and see what they're going to be doing to housing and housing subsidies. There's a real attack on LIHEAP, the low-income heating assistance program. Food subsidies, as the Congresswoman mentioned, are in jeopardy. Head Start's on the edge of being cut back. All you have to do is read the scientific literature on how to make America healthy, and you will find that they are attacking and decreasing exactly those investments that smart countries make to help their populations get healthy, in addition to a robust healthcare system. I want to mention one other, and that's air and climate. That's my wife's field, but I get educated every day on it. What this administration is doing against decarbonization and trying to fight global warming it's criminal. It's homicidal. Trump has stopped the development of offshore wind power in the United States. That's the only source we can have for the actual production of sustainable energy at high scale. Offshore wind is the answer to the burning of fossil fuels, and he has stopped it. I can't believe it. Today, I believe he took down the Energy Star system. To me, that's just it's vicious. It's small-minded. That's an incredibly valuable program to help those who want to get more efficient in their homes and industries to actually know how to do it. He's cut back on NIOSH to decrease worker safety and cut back on our ability to monitor the pollution that caused the asthma of the children that I took care of as a practicing pediatrician. It's criminal. I won't even mention at length right now what he did to USAID, which is the top of my list. This is a homicidal presidency. 20 million people may die with the cutbacks in international support that he has shamelessly purveyed. We need to stop it. Medicare for all is a good topic. We should be talking about how to expand Medicare, but we have to fight on as broad a front as he is. I agree with every word that Congressman Pressley said about the level of mobilization that we need. If we remain silent, we and our successors, our generations after, will suffer irreversibly. We have to flood the zone for good, like he's trying to flood it for evil. That's all I have to say right now. I remain available for any comments or questions, and I'm sure Congresswoman Pressley can add detail as long as she can stay with us.
Great. Well, thank you, Don. And I didn't have a chance since we started with Ayanna to say that we encourage people to put questions in the chat. We will have an opportunity for Q&A, so please put your questions in the chat. So at this point, I'm going to call on Jamie Willmuth. Jamie is with 1199 SEIU, and for people who don't know, 1199 has about 80,000 healthcare workers in Massachusetts, and is part of the larger healthcare union of 1199 SEIU with almost 500,000 members, 450,000 members on the East Coast. 1199 represents workers in community health centers, personal care attendants, home care, agencies working consumer homes, and hospital workers. And Jamie is the senior policy analyst for 1199 and works in collaboration with unions research, political departments, providing legislative help, lobbying, organizing, and other support for growing the union and the political advocacy of the union in terms of protecting services and the members who provide the services in Massachusetts. Jamie? Did we lose Jamie? Did we lose Jamie? Oh, there you are.
I don't think so. I don't think so.
Good.
Okay, you can hear me now?
Yes, we can.
Okay, and can you see my slides? I don't know if you can
Yeah.
see my slides. Okay, let me try that again.
Okay.
Share, slides, share. How about that?
Started screen. Yeah, there you are. So just go
Okay,
to,
so if
go to
I do
presenter
the
mode.
slides from the beginning, now you can see slides on the full
Yes.
screen and hear
We're
me.
good. Yes.
All right, great.
Thank
So I only got 3 slides. So I wanted to start sort of where Don started, which is to talk a little bit about the current state of the healthcare system. I was going to focus on Massachusetts, where I think the healthcare system is in a pretty tenuous and dangerous place. You know, it's still significantly understaffed in a lot of areas. We simply don't have the number of nurses, CNAs, other professionals that we need and are to staff our hospitals, our nursing homes, our community health centers. And you know, that's a result of underpaying people, but also the high cost of living in Massachusetts. People taking their talents elsewhere where housing is not as expensive, and just a general sort of mismatch between the available labor and the systems. The other major issues facing the system are the affordability. Healthcare expenditures continue to grow unsustainably. The providers continue to miss the benchmark that says they're only supposed to grow 3.6% in their expenditures every year. Last year they grew a little over 8%. You know, and some of that is COVID related, but we're on a path to unsustainability, where healthcare premiums that people pay are becoming increasingly unaffordable, and this whole system is on the verge of being in real trouble. And on top of that, we have financial problems. Most of our hospitals are losing money. The average nursing home loses 3% operating revenue every year. The average hospital went into negative just in 2024. They are now at about -1% on average. And there's a lot of variability there. The MGBs of the world are doing all right. They have a lot of investments in the stock market, and they don't really rely on their operating revenue as much as others. But there are lots of hospital systems, not just Steward, who are in financial difficulties. And that's the context where we're facing these two big looming threats, right? The first, I'm not going to talk too much about, but is deportation of immigrants. There are a lot of healthcare worker immigrants in our nursing homes, in home care, in our hospitals, in our health centers. People who are here legally working with work permits on temporary status or parole, but they're having that status revoked or the Trump administration is trying to revoke that status. As of August 3rd, temporary status for Haitians, Venezuelans, Hondurans, particularly Haitians immigrants, are an important part of our healthcare system, and that those cuts would be devastating. And then obviously we have Medicaid cuts, which I'm going to really talk about the most here, potentially billions of dollars lost. So let's look more closely at the Medicaid cut impacts. So this is my slide on the impact on our providers, our employers at 1199 SEIU. Our hospitals and health systems right now are an average of 70% public payer. 20% of that is Mass Health. 50% of that, of course, is Medicare. But safety net hospitals like BMC, Cambridge Health Alliance have about 40% Mass Health Medicaid patients. When I say Mass Health, that's the same thing, right? Medicaid is called Mass Health in Massachusetts. Nursing homes, it's even bigger. 3 out of every 4 residents has Mass Health. They rely on those dollars to even stay afloat. Sorry. And then you have home care agencies, that do a lot of Medicaid home health, and you have the PCA program. I saw Chris on earlier. He's one of our closest allies on the PCA program, and that's facing a lot of cuts already. If Medicaid were to be cut, it's 100% funded by Medicaid. 95% of those costs, it's about a $1.5 to $2 billion program, and 95% of the cost goes to wages. The personal care attendants who make $19.50 an hour. These are not overpaid workers. They are not. They are already on the edge, and these cuts will be really, really devastating to these providers. And then, so obviously that impacts the workforce, right? The provider's ability to get fair reimbursement for care, to get the revenue that they rely on to make up for all sorts of other funding issues. That's the money that they use to pay our workers. And healthcare workers are healthcare consumers also. They face all the same challenges. A lot of them are on Medicaid. A lot of them are making $19.50 an hour. They're working 20, 30 hours a week, and they don't make enough to afford any insurance that's offered to them by their employer. That's particularly true of nursing home workers and home care workers. A lot of our hospital workers have decent insurance, given the ones that we negotiate for. The issues that they face are, as consumers, challenges to their wages, the ability of their providers to offer living wages, staffing levels. I mean, as I started, our staffing levels are already extremely low. Any sort of cuts, layoffs, cutbacks in the workers, you're just going to have more crowded emergency rooms, more difficulty admitting people out of hospitals into nursing homes who are already denying admissions, even though they have empty beds. They just don't have the staff to staff them. And then we have issues around our future contracts, right? That's from the union's perspective. That's the biggest danger for Medicaid. We have major negotiations with employers coming up this fall. We are negotiating our PCA contract next year. Any Medicaid cuts that are enacted or looming or expected are going to impact those contract negotiations and make it really, really difficult for us to get our workers closer to a living wage. So I've gone on for 7 minutes and 20 seconds. Um, so I and yeah, that's so I'll stop there. I just wanted to give sort of that overview, and I'm happy to sort of answer questions when we get to that part of the agenda.
Great. Thank you, Jamie, and always good to hear what the perspective is from the union in terms of how workers are impacted because we don't have a healthcare delivery system without the workers who are actually providing the care. So our third speaker is Alex Sheff. Alex is the Senior Director of Policy and Government Affairs at Healthcare for All. And his work focuses on healthcare affordability, the social determinants of health, and delivery system reform. Alex also served in the past as the Senior Program Manager for Medicaid Strategies at Mass General Brigham, which is also an interesting perspective. We asked Alex to talk about what he saw as the impact of potential cuts in Massachusetts and what people can do to fight back, because it's not enough to moan, we need to organize. Alex.
I love that you started with that quote. So thank you all. I'm going to also attempt to try to share slides here, although it looks like I need to send a request. So I'm going to start talking, and then when it's possible, I'll try to share slides. So for those, I am just going to give the 2 second. For those that aren't familiar with Healthcare for All, we're actually celebrating our 40th anniversary. We are a healthcare consumer advocacy organization in Massachusetts. We advocate for health justice to ensure there's coverage and access for everyone in the state. We really do three different things. We operate a helpline that takes more than 25,000 calls a year from people trying to access health insurance coverage or navigate their coverage. We take calls in 5 different languages. We run outreach and engagement work and campaigns now, most recently around vaccine equity and then the Medicaid redetermination program. And then lastly, we kind of take what we're hearing from all of that work and we feed it into our policy and advocacy work. And we do do a lot of work at the state level, but in moments like this, we also do a lot of work at the federal level. So with that, okay, and I think I can share my slides now. So I'm going to get this to work. This works. Try to get this presentation mode. Great. Can folks see these slides all right?
Yes.
Great. So I did my Healthcare for All introduction. I wanted to, and Jamie talked about some of this, but just kind of wanted to paint a 3-part picture in terms of the impact of Medicaid. And again, in Massachusetts, we call it Mass Health. It's a combination of our Medicaid program and our children's health insurance program. So in Massachusetts, a couple of stats have been mentioned already. 1 in 3 residents. I feel like that needs to be said more than once. Like 1 in 3 residents get their health insurance through Medicaid. That's an enormous number of folks in the state. It is half of all children in the state. It's more than 500,000 seniors and people with disability, and it's more than 2/3 of low-income families in the state. So the just sheer impact of any even modest changes to the program mean really direct the challenges for individuals and families across the state. The second thing, and this is what Jamie talked quite a bit about, but it's worth just saying, again, there is an enormous impact on healthcare providers of a variety of kinds. Mass Health supports healthcare jobs, and it's a significant portion of healthcare providers' revenues. Half of revenues for nursing facilities, as was mentioned, half for community health centers, covers 1/3 of births in the state. So again, the financial impact is huge here. And I mention this in part because, to some of Jamie's comments earlier, like this is cuts to Medicaid impact people who also aren't even on Medicaid. Because if you need nursing home care and you're not on Medicaid, this impacts you. If you get health care from a safety net hospital, even if you're not on Medicaid, the fact that their revenues are going to be impacted by this impacts you at a time when we have so many challenges in terms of access to care. There's an interconnectedness here. So it hurts people on Medicaid when there are cuts to Medicaid on Mass Health, and it hurts people who aren't because it will really endanger the ability of hospitals, healthcare systems, nursing homes, health centers to serve everybody, and that's a huge issue. And then the last piece I wanted to mention here is the impact on the state budget, and this is where we get a little nerdy and just a little wonky, but Mass Health, Medicaid, represents 86% of all the federal funding that the state gets in any given budget year. 86%. So again, any small turn to that dial has a huge impact on the state budget. So even if you don't care about healthcare or Medicaid, if you care about education or local aid, this is going to impact you because anytime you start to take away that portion of our federal funding at the state level, you end up causing enormous budget trade-offs that frankly the state just cannot absorb. So the next thing I wanted to do for just a minute is to talk about a couple of the specific cuts that have been talked about, and I want to deliver a broad message first before I get into the details. And the broad message is this: every single one of these cuts will do one of three things, or it will force the state to do one of three things. Cut benefits. So if you want dental coverage, that could be at risk. To cut eligibility. So if we want to cover all the people we want to cover, that would be at risk, or cut payments to providers. So every single one of the cuts that are on the table would do some combination of those things to varying degrees. There are no good cuts. There are only bad options here. So the first one that's being talked about is work requirements. I will candidly say this seems to be the one we are having the hardest time fighting at the moment. But just to say, this would require Medicaid enrollees to verify that they're working, and this is a little bit absurd on a variety of fronts. The first one is that we know in Massachusetts, this is largely true in a lot of states, 3/4 of Mass Health members under the age of 65 are working. So you're asking people to verify a thing that most of them are doing anyways, and the ones that wouldn't would likely qualify for an exemption. The second thing is that, we know from the experience of states that have tried this, states like Arkansas and actually New Hampshire for a little bit, that the result was actually that most of the folks that lost coverage from these policies were actually working. It was just about the sort of burden of administrative burden and red tape that was keeping people who should be eligible. This isn't keeping ineligible people off of coverage. It's keeping eligible people off of health insurance coverage. And then just to throw some numbers out here, kind of the range of folks that could be impacted is between 236 and 954,000 Mass Health members that could be at risk. That last number, that's nearly half of the Mass Health population. So that's work requirements. Second one I want to talk about is a term, again, it can sound kind of wonky, but this is FMAP, or reducing the federal match rate that states get for their Medicaid program. I mentioned 86% of all of our federal dollars come from Medicaid. This is each part of that. So there's a couple of different options out there. One would lower that federal match percent, basically lower the amount of money the state gets for the expansion population, folks that got coverage under the Affordable Care Act when Medicaid was expanded. There would be an enormous budget impact for that, $1.37 billion. It represents essentially a 400% cost increase to covering that group of folks, and it's 400,000 people that are in this bucket. And then the second one is lowering the federal match floor from 50% to 40%. That's actually an even bigger cut to our state. It would represent a 20% cut to all of our Medicaid funding in the state. Okay, and then the last one I wanted to talk about, although I'll add just a couple of more caveats at the end, is per capita caps. Again, a wonky word, basically just means federal government's only going to let you spend a certain amount of money per person on Medicaid. It fundamentally changes the program from a guaranteed benefit program. And a new version has talked about doing this just for the Medicaid expansion population. That's, a lot of working low-income adults in the state. And basically, as I said, any kind of change like this is going to require the state to do one of three things: cut coverage, cut benefits, cut payments to providers. All bad things. The last couple things I'll mention here when we talk about what we can do is, because Enid mentioned it, I didn't put it on here, but provider taxes. If you hear provider taxes, again, just think a way for the federal government to cut the amount of money that states can raise to support their Medicaid program. So it's just another way to cut funding for states for Medicaid. And then the last one I wanted to mention is there may be specific attacks on immigrant populations, so they could propose rolling back federal funding for states that even cover with their own dollars undocumented or different Medicaid or different immigrant populations. So they could try to punish states for doing that, even if they're doing it with just state dollars. So those are all the policies. I'm going to end here with the sort of call to action and what we can do about it. And I'm going to tee this up, but I know others are maybe going to talk a little bit more. So, healthcare for all, 1199, SEIU folks are going to be working to launch a phone banking effort over the coming days, weeks, months. We'll see how long we have to go. To make calls to constituents in key congressional districts. So Congresswoman Pressley mentioned this. Really, there are a handful of, frankly, Republican members of Congress that are on the fence here, somewhere between 12 and 20 of them. And they will really be the ones that decide whether these cuts happen or they don't. And while they don't care that much what we have to say, what we can do, and this is a lesson learned from the fight in 2017 when we stopped the repeal of the Affordable Care Act, we can call folks in those districts, in those states with those key members and say, hey, did you know your member is going to be the deciding vote here? Will you call them or can we patch you through to talk to them to say, please don't cut Medicaid? It's so important. I can say this also, I didn't mention this, but before I was even back in Massachusetts, I'm from here originally, I worked in Congress for a number of years. I worked for Senator Stabenow from Michigan. And I can tell you, like members they calculate at the end of the week how many calls they get pro and con on things. Even though they don't always admit it, they are absolutely listening to this. And so in these key districts, this is the kind of thing that can make a little difference. And as Enid said, we are starting to see like some cracks in the armor here. Some of these members saying, I don't want to go all the way out there on these big cuts. I'm not ready to say yes to changes to the federal match rate. So we saw the markup in energy and commerce delayed by a week. Every delay is a win for us. Having been on the other side of this when we were working to pass the Affordable Care Act, every delay was a danger for us. When you're on the side of trying to do this, every delay is a chance for the opposition to grow stronger, and so we're gonna keep trying to do that. I think that folks are gonna drop a link in the chat to sign up.
It is in the chat.
It is in the chat now. Great. So I encourage everyone. Like this is the kind of thing that can make a real difference. So we want everyone who can take action to do so. So I'm gonna stop there. Thank you, Enid, and happy to take questions.
So people, please look at what's in the chat. It's especially really important for people to volunteer. As Ayanna Pressley said, we need the choir, we need the chorus, we need hundreds of thousands of voices stepping up. So speaking of stepping up, Crisayda Belén from Field First will be our last official speaker. She brings her experience and diverse skill sets in campaign strategy, data, and analytics, hard word to say. And works closely with Field First. She was also, for people who don't know, one of the leaders of the ballot campaign to enable Massachusetts residents to obtain a driver's license regardless of status. Really important win for our state and something we're all very proud to have participated in. So one of the questions that came up a lot in the chat is, how are we going to pay for this? What are we going to do financially? Rainy day fund, other strategies. So I turn this over to you now, Crisayda.
Thanks, Enid. What an introduction. I appreciate you. Great to be with everybody this evening. I know we are closing in on an hour, so I'm going to try to be as quickly as I can. And a lot of great things or similar things were said already. So just going to feed off of the wonderful presentations we've seen today. I'm going to screen share, and please just give me a thumbs up once you are able to see my screen. Just let me know when it's good to go.
We're good. Oops, we were good. We're good.
Awesome. Great. Thanks, Enid. All right. Yeah, my name is Crisayda Belén. I am a campaigns director at Field First, and we work very closely with the Raise Up Massachusetts Coalition. You might know Raise Up most recently from the Fair Share Amendment. They worked on passing a constitution amendment in the 2022 ballot that created a 4% tax on a person's income over $1 million. Since then, I'm happy to report for folks that might not be familiar that it has generated around 2.4 billion, that's with the B, dollars in revenue for the state that is now being invested into critical resources for the state on public transportation and education. And happy / not happy to report that our work continues to making sure that large people are paying their fair share. Is just shifting now from individuals over to mega corporations that have business in the state. I'm just making sure I have everything. Okay. So the problem that we are outlining on the table is that currently Massachusetts as a state is losing hundreds of millions of dollars each year because all these mega corporations that we are familiar with, like Apple, Amazon, McDonald's, and Walmart, are currently shifting some of their profits offshore in what we're calling offshore tax havens. So in countries like Bermuda and the British Virgin Islands, they are shifting their profits in order to avoid paying the current corporate tax rate of the state. That in turn means less money for resources that we are discussing today, like healthcare, infrastructure, and other public services that we heavily rely on. So we are in a position where we are anticipating the problem, and we are working actively to have solutions ready to go as a state. And, we've already discussed a lot of this coming off the heels of Alex's presentations. I don't want to dive too deeply into this, but we are seeing magic budget cuts and threats on a state and federal level. So again, seeing some of the problems and anticipating some of these problems and trying to come up with solutions soon rather than later. So we are ready to fight back as a state for all these critical resources. The solution that we have on the table, which is definitely a solution, not a solution for all, is what we are calling our Mass Corporate Fair Share campaign. So kind of an ode to fair share amendment from a couple of years ago. We are part of this campaign is sort of highlighting an existing provision that is part of the federal government and also in the Massachusetts tax code called GILTI, which is short for Global Intangible Low Taxed Income. And it's actually a federal provision first enacted under the first Trump administration, so it's nothing new. What essentially this says is that it makes these global mega corporations pay the state's existing corporate tax rate, which is currently at 8%, on the share of the profits that they are shifting or they concealed offshore. And that in turn generates hundreds of millions of dollars in new revenue for the state. In connection to this, currently Massachusetts tax only 5% of that offshore profit of these mega corporations for GILTI purposes. And if we're looking at the sort of federal landscape, because it's the federal provision, states are able to tax it. Currently, the max allowable taxable rate for GILTI is 50%. Massachusetts, again, only taxes at 5% of those profits. So if we're looking at our neighboring states, for one, we see states like New Hampshire, Rhode Island, Vermont, and Maine are having GILTI at 50%, while states like us, unfortunately, are only at 5%. Again, this equates to just hundreds of millions of dollars that we are losing by not having this allowable provision at the max rate of 50%. And, I live very close to New Hampshire. I'm almost nearly on the border. And for a state that prides themselves in not taxing pretty much anything, for New Hampshire to be one of the states that does it at the max allowable level of 50%, and for us to only be at 5 is a little bit of a shock value for all of this. So our proposal is honestly quite simple. We just want to bring Massachusetts up to standard of GILTI from 5 to 50% and follow the leads of, quite frankly, most of our neighboring states with this federal provision. I want to do a quick overview here of sort of the landscape federally. So you'll see it's a little bit of a difference across the board. Our neighboring states are at 50, but you see states like us and Maryland and New Jersey that are, states like us and New Jersey and Connecticut that are at 5%, but other states that have pretty comparable economies like us, like Maryland, that are sitting at 50%. So this is certainly something that is doable. And Mass Budget did a current report on how much revenue Guilty would actually be able to generate, and it currently sits at over $400 million a year that of extra revenue that would be generated in the state. And this is just money that we are currently not only leaving out on the table, but we could be using right now to fund all these critical services that are threatening cuts on the federal and state level.
I've been putting a link to that mass budget report in the chat, just so you know, Crisayda.
Jamie, I appreciate it. Thank you so much. And I'll just end it here. This actually is a very popular issue. When polled, we're doing very recent polling across the state. I'm sure it's no surprise to anybody here on this call. When asked the question on whether or not people are in favor of closing these corporate loopholes that prevents these mega corporations from paying their fair share in taxes, a lot of people across the state are in favor of this. So this feels like a no-brainer in terms of, again, being a solution to the problem that we are all anticipating today and all these major cuts threatening healthcare specifically. I think this is mostly it. In terms of what we can do in support of this, we are seeing this as a very strong legislative campaign. We are upwards of the high 90s in co-sponsors across the state legislature. So highly encourage folks to reach out to your legislator if they are not yet a co-sponsor or supportive of this, to just sign up and co-sponsor. Once we are very close to a majority, we are 7 House members away from a majority. We already have a majority in the Senate. Once we have that majority, we can easily go to leadership and say, hey, if this can ever go up for a vote, we can for sure have the votes to pass this and pass it today and not wait until the worst comes to worst in the next couple of weeks as we are anticipating it. So would appreciate all the help and support there. Again, this is a solution, not the solution to the threats and issues that we're facing today. We are working very closely, or I'm working very closely with Alex, who just presented on the phone banking program. So again, just want to do a final pitch to what he said about the phone bank work that we are doing. Highly encourage folks to volunteer, sign up to volunteer for that. We will have a lot of upcoming information on it. But yeah, working together on this. Any questions that folks have on Guilty or Mass Corporate Fair Share, happy to answer any of them. And Enid, you're on mute.
Muted. Thank you, Crisayda. Somehow I got muted. I just wanted to make sure that people understood the connection here. This is not like an afterthought here. Raising state revenue is going to be really important in the face of cuts. And we know how successful the Fair Share program has been in terms of generating, certainly more than $2 billion a year. So I just want to make sure that people understand that there actually is a connection between the two. So we had a couple of questions, and I'm just going to throw them out, for people and see, if anybody particularly wants to respond. So one question is, given which we don't know how the cuts actually play out, how does this impact, the connector program and, our program that's been in effect for a number of years that gives people the, ability to buy health insurance and supposedly provides healthcare for all in terms of at least availability let's not talk about the expense part, but the availability part. Does somebody want to take on that question? If one of the speakers do, can you just speak up because I can't see everybody?
Sure, I'll jump in.
Okay.
Totally. This is totally Alex's.
I was about to say, this is like my thing. Happy to talk about this. So I think there's 3 answers to this question. The first is, I just want to say, like, at a big picture level, any kind of cuts of this scale to Medicaid will make it difficult to continue to support the Connector Care program because there's just, like with all these things, there's a limited amount of state dollars. So I think big picture, even cuts to Medicaid, have the potential to threaten, the funding for the Connector and the Connector Care program and the important coverage that it offers to so many people. And we know also the Healthcare for All worked very hard to expand the Connector Care program in the last couple of years, helping more than 60,000 people get more affordable coverage. So that's part number 1. Part number 2, unfortunately, and I think Don Berwick pointed this out in the think of him as Administrator Berwick still in my head, pointed this out in the chat, but the Republicans in Congress have also been, it seems, set on rolling back the enhanced federal subsidies that have helped in the last several years to fund connector care and subsidized coverage. And so that is very concerning. We don't know, like there will be a part one to this fight and a part two. That conversation may not happen until the fall, so stay tuned. And then I guess I would just say part three, not to end on a downer note, but this is the place where we have to be real, which is that there are some changes that the Trump administration can make without Congress, and they've started to do that already. So I'm saying this to help people be aware, they're making changes to shorten the open enrollment period for when you can sign up for Connector Care every year. People have less time to do that. They'll be maybe make it more difficult in terms of validating information. They can unfortunately, they may be able to like increase premiums by reducing subsidies and increase people's cost sharing. Again, just through the rulemaking that they've started to do. So good for folks to be aware of that. We're going to keep trying to get the word out, but there are several attacks at the moment on the federal level on this Affordable Care Act coverage and the connector coverage. So I'll stop there.
Great, thanks. Another question is, given that the level of the crisis and the fact that we're in an environment where everything's thrown up to be a crisis, how do we get people engaged in this question, and how do we get people out of like it's hopeless to having some hope and ability to actually win on this? So I'd be curious, from everybody's perspective, since we have people who do a lot of organizing in their jobs. Jamie, Crisayda.
I mean, I'll let Crisayda answer that mostly, but I'll start by saying, in mobilizing our members, we have 80,000 members in Massachusetts, and 500,000 across the Eastern Seaboard, and we're all in on this fight, and what we've been saying to our members is a lot of what I said in my presentation, which is your employers rely on Medicaid. We rely on that revenue they rely on that revenue in order to pay you a living wage. And as we go into contracts, the worst thing that we could see is large Medicaid cuts, and financial uncertainty for the healthcare providers here in Massachusetts. So that's the connection we're trying to make, is that, this is not just about the 2 million people who get Medicaid in Massachusetts, 1 out of every 3 residents. It's a little less than that now, but it's also about jobs and the economy, and hospitals are the biggest employers in a lot of places, they're the biggest. They're a huge part of our workforce here in Massachusetts. So that's the connection we try to make when we're motivating our members. Is this is not just about Medicaid recipients. It's about preserving Massachusetts' first place in the nation as with the lowest uninsured rate in the nation that we continue to have. But Crisayda, you want to sort of add to that? I'm sure you.
No, sure. I think you pretty much nailed it, Jamie. But I think when we look at news on a federal level, it's pretty easy to sort of, we get so much volume of it that almost you just become sensitized to it, for one, but also it's really hard to sort of disconnect from it in the sense of like, we live in Massachusetts. Everything will be fine here, right? We have a Democratic governor for the most part. Everything will be fine here. But the reality is that all of these cuts happening on a federal level are going to have a very real trickle-down effect to our state budget. So similar to what Congresswoman Ayanna Pressley was saying, is that we need to build a movement, and I pretty much believe and truly believe that we are on our way to doing so, and we have. But it's sort of making that connection of, hey, this is going to impact all of us in the state. It's not just something that is going to happen on a federal level, and we're never going to see the effects of it. And it's going to impact your neighbor. It's going to impact your grandmother. It's going to impact your kids. So making that personal connection and letting us know that, again, we're anticipating this and we better do it now before it's, a little too late.
Alex, you want to chime in?
I do. I just want to say one thing, which is that, like, I can't say this about every issue. Like, sometimes I read the news and I'm like, oh my God. But But on this Medicaid issue, like this is a winnable fight. I swear to God. I'm not sure we can stop every cut, but we are like, this is a winnable fight. There are 12 to 20 members. They are absolutely scared that they are going to lose their reelections because of this. And if we can, again, get folks in those districts to reach out to them and let them know the level of opposition, I really believe this is one where we can stop the worst cuts. And we've done it before. We did it in 2017. I sometimes think about like it's really important to go back and look at when we've successfully done things like this before. And we did. I thought the Affordable Care Act that we fought so hard to pass was going to die, and it didn't. And so I think there are, there's a roadmap here, and this is winnable. And I should just say, we've talked about, Congresswoman Pressley. Our delegation has been great on all of this, and if you just want to like thank them, like Congresswoman Pressley and others, and Clark, like they've been out there, they've been talking about it. Senator Warren, like they've done op-eds, and so I think that all of that helps too. So I just want to give them credit for doing that work as well.
Okay. Let me just check on process here. We're going to go till 8:20, just so people know. So hopefully people hang in here because we want to hear from we have a few announcements, want to hear from the two organizations co-sponsoring. So let me ask a question just in terms of strategy. So the calls that people are going to be making are going to be making into Republican districts. Is that okay? And these are Republicans who we think are movable. Okay, I just want to make sure. So hopefully people, because a number of people have asked this in the chat, what can we do? Can we reach out to Republicans in other areas? And that's exactly what these targeted calls are to do, correct?
That's right. The one tweak I will say is, so believe it or not, and I mean these are what are affectionately referred to as purple districts or swing districts. So there are a lot of Democrats and a lot of Republicans. So in case anybody's nervous about this, we're not calling a bunch of MAGA Republicans in these districts and saying, "Hey, can you reach out to your member?" We're calling Democrats in those districts who are like almost the majority, but not quite in some cases, right? But like, and we're asking them to make those calls. So it will be hopefully, for the most part, though not always, friendly voices on the other end, but people who care, at least care about healthcare and might be willing to be patched through to their member of Congress.
So as somebody who's phone banked on many campaigns, you're not done. When you do this, you actually have a script. You're actually working off of it. You will get training. So for people who feel like, oh, I don't think I can do this, this is something doable. And it always feels really good doing it. I remember during 2017, my husband was homesick and he ended up making calls, and it really made him excited that he was home, from work, and yet he could be making those calls. And, it was, he felt like he was contributing. So I just think it's an important thing for people to do. Let me ask one other question, just in terms of Massachusetts. Mass Health, which is the Medicaid program, are we hearing any specific rumblings about what they think they're going to be doing, or is it too early to tell? I'm just curious, like both for 1199 for healthcare for all, you're obviously at least in some conversations with people. So I don't know if there's anything to share at this point.
I mean, we met with the Ways and Means chair of the Senate last week, and we obviously spent a lot of time with the House Ways and Means folks last month. I would say that they are in a wait and see mode for the most part. For the most part, they are proceeding with this year's budget, which they need to pass by June or early July, depending on the date. And they're going to pass a budget that assumes that there will be no federal cuts. But as Alex pointed out, we get $16 billion from the federal government every year supporting Massachusetts. And, I think 75% of that, $12 billion, somewhere in that range, is for Medicaid alone, matching federal funds to pay for our Medicaid. So these are huge holes, giant holes. The Senate came out with their budget this week, and they pointed out that Medicaid spending is going up over $1 billion. I think it's close to $2 billion. Whereas, and there are a few other areas where there are increases in the budget, but the bulk of the budget is flat funded. There's $51 million in other increases scattered throughout the budget. Once you take away sort of the Mass Health and some local aid, so they don't know what to do. They're waiting and seeing, and that's why we're pressuring them. We continue to, every time we talk to them, we say, you really need to consider using the rainy day fund, which has close to $9 billion in there. You really need to consider GILTI. We have this idea. if you have other revenue ideas, we're open to that too. I think we're trying to prepare for the worst and hope for the best. But I don't think that they have any, firm plan about how to get around this. It's just too massive a problem if it comes out,
Alex,
the way
briefly,
we
anything to add?
fear.
Yeah.
I just wanted to say, I think that wait and see approach is a really good thing. So we supported that. I think others, we didn't want the state legislature to do for federal Republicans work for them, right? To cut before we knew what was coming. And I think it was really smart of them to wait because we don't know what's actually going to make it all the way through this process. And so we don't want to do their work for them. So.
Thank you, everybody. I know there's a lot more questions. Let me ask you, are you willing to share your slides?
I should double check with my team, but probably.
Okay, yeah, you could, because people have been asking in the chat about the ability to get the slides. So that would be good because we usually send a follow-up email to people with the action steps as well as the slides. Secondly, I think we have two of our co-sponsors from ORMA and for Mass Care. If they wanted to say a word as a sponsor, I don't know, Jonathan, if they're still there or what.
Yeah, we're still here, I think.
Okay, John, are you going to say something about Mass
Yeah,
Care?
yeah.
Great, thank you.
Let me thank you, Enid, and thank you, John, and thank you, PM Progressive Mass. Mass Care, most of you hopefully know already, is just a nickname. We're the Massachusetts Campaign for Single Payer Healthcare. And we're very proud to be part of the fight against Medicaid on the immediate level and proposing the permanent solution for the future. And we're thankful that Progressive Mass and our Revolution Mass, the other co-sponsor, and 1199, the presenters, are members of the Mass Care Coalition. I did want to emphasize that our proposal returns over $37 billion back into the Massachusetts economy, more than enough to withstand any attacks by T. Rump and company. And just the surplus, the operating surplus for the first year of the Massachusetts Healthcare Trust is estimated by our economist, Jerry Friedman at UMass Amherst, at almost $8 billion. So that's 3 to 4 times the size of the anticipated cuts by T. Rump. So what we need, of course, what we're talking about, of course, is a transfer of wealth back into healthcare from profits, fraud, waste, and abuse. And that our legislature is unwilling to do. So these movements that involve more people in fighting back against T. Rump at the federal level are motivating, I hope, more people to fight back, to convince their legislators to go for a fix.
Okay, thank you. Thank you, Jonathan. And I know Jonathan Cohen put information in there about the Mass Care anniversary celebration. Anybody
Thank
here
you.
from ORMA on the phone? Okay. All right. Well, I don't know if they're here. I wanted to thank our speakers. Hopefully people got something out of this forum, and we hope that a lot of people will sign up to volunteer. So this is the second forum that we've done. We'll be doing one in June, either on the housing crisis or what's happening with climate change and the climate crisis. I guess whatever one reaches the top for that month. But I want to just thank people for participating tonight in this forum. I think we're privileged to have Congresswoman Pressley, Don, Alex, and Jamie and Crisayda to have a really rich conversation about the crisis facing us, what we can do, and also potential solutions in Massachusetts. So thank you everyone for participating, and a special thank you to our speakers for participating. And we're actually ending at the time we said we were going to end, which is always a good mark too. So thank you everyone for participating.
Thanks, everyone. It's great.